While change takes place in this world at a feverish pace, it is a comfort to know that your pharmacist is always there for you. Perhaps you've come to the pharmacy only when you were ill or needed advice on a non-prescription medication. Whatever the reason, this highly trusted member of the health care team was ready to serve and willing to offer helpful suggestions. In many ways, this has always been the role of the pharmacist. The role that we recall from our parents' stories, from films, and from our own experiences. The pharmacist's commitment to quality. What began as a 6-month-long apprenticeship at the turn of the century has evolved into a profession that requires at least 5 years of training. But the learning doesn't stop with the diploma and license. A pharmacist's education always continues in order to assure that they remain your most accessible and highly trained professional. And now, so that you may get to know this profession a little better, we invite you to spend a few moments with your pharmacist behind the counter.
Why not?
But fuchsia? Marge, you hate fuchsia.
Yeah, but Harry hates it even more.
I bet that didn't do his rash any good.
Oh, his rash is just fine.
Still itch?
Oh, no, it's gone.
Gone? But he's been fighting that for weeks, hasn't he?
Yeah, well, he found some cream for it, and it went away.
Marge, you didn't order something from that magazine, did you?
No, I didn't order anything from the magazine. I got tired of his complaining. So I walked him right over to the drugstore, and the pharmacist was able to give him something right off the shelf, and it's gone.
Oh, sure, just like that.
Just like that. Now, the pharmacist said that if it didn't work, he was to get right to a skin doctor. And so now Harry's back to normal every night playing poker, and we're going to have fuchsia curtains in the dining room.
I wonder what they do over there.
At the poker game, I'm sure I don't want to know.
No, in the drugstore. You know, they're always up on that platform, talking on the telephone. They're wearing those white coats. They're always reading something.
And Sylvia said they don't even eat lunch.
Well, that settles it. I'm going to check this out. Are you going with me?
Oh, no, you can include me out. Going with you usually means trouble.
Well, all right, fine. Hey, how about you? Do you want to go with me? Okay, great. Come on.
May I help you?
My friend and I, we'd like to see the pharmacist.
Sure, just a moment, please. Mr. Gower, you have company.
Oh, hello.
Hello. My friend and I, we're thinking about becoming pharmacists, and we thought maybe you could show us what goes on back there.
Well, certainly. Come around back. This is where we center most of our work. A lot of people are afraid of the computer, but it's a valuable tool back here.
You mean like a typewriter?
Oh, much more than that. It is a typewriter, but it's also a database, an interaction reference, a calculator. It's just one of the many tools a pharmacist uses in his day-to-day practice.
But how does that help in
Filling a prescription? Let me walk you through it. It all begins actually before the patient comes to the pharmacy. The physician uses his medical expertise to properly diagnose and determine the proper course of therapy. It's the pharmacist's job to follow through with that therapy and reinforce the importance of the patient's role in it.
The patient's role?
Of course, the patient isn't just an observer in all this. Everyone must work together as a team. Now, take this prescription.
How do you read that?
I assure you it's never guesswork. If there's any question, the physician is called up right away. Now, the normal procedure is to bring up the patient's profile to see if there's any possibility of allergies. In this case, there are none. The computer program will double-check that for us. It will also check to see if there's any duplication of therapy. Now, we take the information in this prescription, which reads very much like a recipe, and we enter it in the patient's profile. Now, we see Mr. Zimwalt has purchased all of his medications here, so we have his complete record, and we can refer to it at any time. April here will normally count out the tablets.
Is she a pharmacist, too?
Oh, she's a technician. She started out as a clerk, but became curious as to what was going on behind the counter, just as you did. She became certified by the State Pharmacy Association and is planning on attending pharmacy school in the fall.
How many years is that?
5 years.
5 years?
Oh, yes, even longer for a clinical degree. Mary over here has just gotten her license and has just completed her residency program. She's been helping us out with some patient chart reviews. But let's get back to this prescription. We print up the label, we check it for accuracy, and then we give Mr. Zumwalt his medicine. However, because he has new therapy, it's my job to make sure he understands what he has to do.
To play his role.
Exactly. I have an extra coat. Do you want to see if it fits?
Oh, no, thank you. I feel safer with you back here. But what's in that bag? Is that a new drug?
No. You see, Sylvia was wrong. We do get to eat lunch sometimes.
Oh. My, this has been interesting. I'm glad you thought of it. Let's come back again real soon.